Good day. Our lecture for this afternoon would be on basic communication skills. First and foremost, in communication is establishing rapport, and that is affecting the field of consciousness of the person you are communicating with. And this is such an important skill, especially for would-be medical practitioners like you. So how do you go about establishing rapport? So for one to be able to communicate effectively and establish rapport, you need to have self-confidence. There must be a basic understanding of people. You must show enthusiasm. You must show interest, that you are interested in what the other person is talking about. It is important to make eye contact, and you must show that you are interested in them. So communication is a series of experiences of the senses. It includes hearing, seeing, smell, touch, and even taste. So what does it mean to communicate? So it's a dynamic process, meaning it takes at least two persons, for you to be able to communicate effectively or ineffectively. Through this process, we are able to convey thoughts or feelings to someone else. And how it is received depends on a set of events, stimuli that person is exposed to. How you say what you say plays an important role in communication. And it is important to see that the total communication process does not only involve speaking. In effect, listening makes up 45% of the total communication process, with speaking just comprising of 30%, reading 16%, and writing is 9%, but all of this would be important with your communication skills. There are different levels of communication, namely verbal. So there is intraverbal, which includes intonation of word and sound. So for example, you would say that I'm angry, but your intonation does not show. So that, or say, oh, I'm not angry, but your intonation does not show as well. So extraverbal, verbal implication of words and phrases and semantics. So of course, some would have connotations. Nonverbal, as important as your verbal communication, and this would include gestures, postures, and movements which are important when you are establishing rapport and communicating with a person. It could be also symbolic, where we learn other forms of communication. Okay. So there are barriers. With the communicator, what prevents you from communicating effectively would be unwillingness to say things differently or unwillingness to relate to others differently. You are not open to learn new approaches. You lack self-confidence. You lack enthusiasm. Your voice quality may be lacking. You have your certain sets of prejudice. So there could be disagreement between your verbal and non-verbal messages. You have negative self-image, lack of feedback. You lack motivation in training. limitation of language and vocabulary level, as well as self-awareness. So that is for the communicator. You fail to transmit the message. It takes two for communication to take place. So there are also barriers with which the problem is with the receiver. Examples would be selective perception, unwillingness to change, lack of interest in the topic or subject, own prejudice and belief system, rebuttal instincts. You have the person you're talking to hasn't finished the sentence and you're already butting in to disagree or to put your own sense worth. Your personal value system, and the here and now internal and external factors. So what are these external factors and external barriers in communication? So your environment, the venue could be problematic, could be noisy, could be warm, the temperature too warm or too cold could affect one's ability to communicate. There may be other people, status or education which may make you more confident or less confident. Time. And these are the 5 basic reasons that we do not listen. Because listening is actually hard work. You have to compete with a lot of different stimuli. For example, as a professor, I have to compete with 400 other students. I have to compete with your cell phones. I have to compete with your thoughts that may be wandering off elsewhere, etc. Rush for action. Listening is a passive skill, but there is such a thing as active listening because you are more often the receiver. Of course, we want to be the one talking. We want to be the one at the center of action. Speed differences, so some would talk slowly, some would talk fast, and words per minute would differ a lot. And there's lack of training. And we have different levels of listening, and there are 4. So there's the non-listener. I hope you do not fall under this category. Marginal listener. You tune in once in a while to listen. Evaluative listener. You evaluate what you hear. An active listener. You evaluate and comprehend and become part of the communication process. So how do we improve our listening skills? You have to focus and you should not be preoccupied with doing other things or thinking about the next thing that you want to say. You should be open-minded and non-defensive when receiving certain thoughts or ideas. So avoid interruptions. Of course, when you talk as well, you do not want to be interrupted. So effective listening is hearing, you interpret when necessary, and understand the message and relating to it. And you ask questions. It means you have fully comprehended the thought process that was tried to convey to you. So communication, 7% would be words. Words are only labels and listeners put their own interpretation on speakers' words. 38% would be paralinguistic. The way in which something is said, the accent, the tone, voice modulation is important to the listener. And 55% would be body language. So, what a speaker looks like while delivering a message would affect the listener's understanding the most. So there are types of body language. So remember that you are dealing with people. So it's important how you hold your postures and gestures. Is it open or closed stance? Did you establish eye contact and how you look at your receiver? Orientation, how do you position yourself? So it's important how you position yourself, especially if it's in a big classroom or if it's one-to-one, how you orient yourself and to whom do you want to communicate. Presentation, how do you deliver your message? Looks, so are your looks, appearance, and dress appropriate? And how you use your facial expressions to express emotions. So your body language speaks out a whole deal of how you are to be an effective communicator.